Welcome to SpeakHarmony, hosted by Sharon Thompson and Dr. Sharon Reed, bringing news, ideas, and community needs. We learn, we grow, we stay informed together in harmony. Our voices are heard. SpeakHarmony, where knowledge meets community.
I can't sing, so I'm not even going to try. So, just want to welcome you once more to the SpeakHarmony podcast, the show, right here on YouTube, live every Tuesday from 7 to 8 p.m. We are the people who speak harmony. So, this episode is brought to you by none other than our amazing sponsor, APAP Media, a photo and production full-service media company specializing in podcasting, multi-camera recording, video, and live streaming services. You may contact APAP Media at info@apapmedia.com. That's apapmedia.com. They've got a number too, and let me tell you, you can reach out to them, look them up on the website. I mean, 470 is their number, 657-1998. But they're right there, and they're doing great things. There's also APAP Media Radio, so that's brand new. So
right.
guys, look them up.
Big up.
Yes. So what's going on, Sister Sharon? I am Sharon Thompson, by the way. Excuse me.
And
how are
Dr.
you?
Sharon Reed, the Heart Lady, here. So we'd like to call this segment Observe the Day. So today is I think I'll save the best for last here. It is National AG Day. And what does AG stand for? Agriculture. And each year, National AG Agricultural Day recognizes and celebrates the abundance provided by agriculture across the United States. American agriculture plays a critical economic and food security role in our country. And, you know, agriculture is more than just putting food on our tables. It helps us clothes, fuel for the cars, medication. It's great for the economy. And so I want us to remember the farmers. And, you know, there's a special sector of farmers that we really want to be thankful for and recognize their efforts. But, of course, it's about the food going to the store and going right on our table. And so one of the ways that you can support Agricultural Day is by visiting your local farmer's market. And I know you've been to the farmer's market.
Absolutely.
Recently, and almost every week or every other day, he's at the farmer's market. And so is my husband. But really,
Yes.
Not just the farmer's market, but the local farmers who set up shop on different weekends and weekdays. So please check those out, right?
Yes.
And, you know, it really started back in 1973, so not too long ago, relatively, right? The Agricultural Council of America, they're the ones who started it. Now, this kind of goes hand in hand with our beautiful esteemed guest. This is the American Diabetes Association. They created Alert Day as part of the awareness since 1986. It has been part of a growing education series where the United States needs to make more effort in helping people understand the stats of diabetes. And it is, whether you realize it or not, it is observed every year on the fourth Tuesday in March.
Wow.
And this is the wake-up call day.
Sure.
And I think that people really need to know how serious it is. And it impacts over 34.2 million Americans. And that's about 10.5% of the United States. And a lot of people have diabetes, don't even realize it. Because if we're not going to the doctor, and we're not talking about how we're feeling, or the doctor is not asking the particular questions, it goes unspoken.
But you know, Sharon, how many people can afford to go to the doctor?
Yeah.
Especially these days.
That's it. Don't have insurance.
No insurance.
That's right.
So, I mean, it's one thing to not
Yeah.
be able to identify it,
Yeah.
but it's another if you can go and get checked
And
out.
get checked out. And also learn some of the preventions.
Of course.
We know that it may be in our lineage. However, diabetes and heart disease can be reversed
Absolutely.
with lifestyle choices. And so if we were to become more educated, which is what alert days are, which is the reason why we have these associations, these great, beautiful associations like American Heart Association, shout out AHA. Yes, that is because I have been a member for many years. So it's important for this day to learn your risks.
Yes.
Don't just go to Google MD. Go to your primary care practitioner and ask them the signs and symptoms, and ask them not only to take the test, but take the time to let you understand what the tests are.
And again, if you can't afford to go, just in case you cannot afford to go, because again, we know that, we recognize that for people who are not going to be able to go, we also insist, because this past Sunday, the SDA, the Seventh-day Adventists, they have a humongous forum every month.
Yeah.
They've got a medical clinic set up on one of those big old tractor trailers, one of those
Yeah. And could get
trucks.
free screening.
Free screenings.
Yeah.
So there's no reason not to go. And if you can get a ride, ask someone. Go to
That's
the church.
right.
Reach out to someone.
Yeah, the churches are able to set up some of those. So even though if you
So
don't
we've
have
got-
health insurance,
Yes.
there are still ways around it. And that
That's
is one of
correct.
the privileges that you have being here in the United States.
For now.
Well, we're
And we
talking
do
right
have
now.
it,
We
and
do
so
have
we
the
do it- we do
privileges,
have it
so
now,
take
so take it-
advantage.
right,
All
take
right, we're not going to
advantage.
get political here.
No. We just want to make
Sister
sure.
Connector.
You know what I'm saying? We want to make sure that we educate our people.
Yeah, absolutely.
Share the information because it's there.
Yeah,
You know?
it is there, and it's incumbent invest in your health.
Yes.
In any way that you
Definitely.
can, because there are many other alternatives that you
Yeah.
can do besides getting on some
Absolutely.
medication.
And I think for the most part, though, Sharon, a lot of us know that there are things that we're really not supposed to be doing.
Okay.
Okay? We know that. There are things that we know that's not good for us. And just to start there, start with investing, like you said, in your own health.
Yeah.
It's critical. It's critical. You know?
Yeah.
So
Stop putting your health in the
Yes.
hands of others.
that's it. So
Yeah.
I have a little phrase, and it's not to offend any doctors out there, because I love my doctors. I love my medical professionals. But I look at it this way. You said about the farmers, agriculture.
Yeah.
I would rather go give my money to my farmer.
Yeah.
I'm just saying. I didn't
feel
say
you.
I'm
I feel
anti-doctor.
you.
I'm just saying that I would rather feed my farmer.
Yeah.
So that's my philosophy.
That's a
only
mouthful
my
right there.
That's only my
Absolutely.
philosophy.
All right.
You know,
apples,
so
apples, and
there you
keeping
go.
the doctor away.
Hello. Thank you for that. Wow, Sharon. What do we have here? So we've got greatness in the house. We do. And I'm just going to say that we have this lady that she is, wow. Where do we start? I mean, I don't know where to, I really honestly don't know how to start it, because I mean, she is a powerhouse. We met her not too long ago.
Yeah, at the Capitol.
At the Capitol, yes, ma'am. And when I tell you, this sister, she's done a lot. I checked out her bio and I thought, wow, who is she? Who is she? So, Dr. Trayce Leak. She is been with the CDC. I'm just going to drop little nuggets around. She will tell you more. But she has been around. She's been director of communications. She's worked in a myriad of places. But now, CDC to the Heart Association, the American Heart Association, that's your place right now. So you've been around a little bit. You've entered a couple of spaces, and you've shared and you've educated folks.
Yes.
Tell us what it is. just take us back to the beginning of how this all got started. Why healthcare to begin with? Well, how did your journey in communications and public relations, how did they marry each other?
Well, first and foremost, thank you for having me.
Absolutely.
It's absolutely a pleasure to be here with you guys this afternoon or this evening. And I would love to be able to say that this was part of some grand plan of mine, but it wasn't. It was a power higher than myself.
Amen.
I did my undergraduate work at Florida State University. Go Noles. we're in, having some troubles right now, but that's okay.
It's all good.
And that was a degree in sociology with a minor in marketing. Always knew I wanted to do something people-centered. That's very much how I was raised, and I was very fortunate to be raised by not just my parents, but to have my grandparents. And until I was 30, I actually had my great-grandparents.
Oh, wow.
Really?
That's very fortunate.
So,
Very.
very people-centered, very family-oriented. And so sociology just made sense because I was very clear, even in undergrad, that I wasn't clear. That was the one thing I knew,
That you were not.
She was
that I
clear.
was not clear.
Hello. There you go.
Yes.
And that is evidenced by things like people in my life, like my sister, who is a pediatrician, who knew at 12 that she wanted to be a pediatrician.
Wow.
And she is a pediatrician.
Oh, I love it.
At 22, I wanted a job, a good one.
Make some money.
But I wasn't sure what that was going to be. So the one thing my mother made me promise, well, there were two, that I would graduate from undergrad and that I would go to grad school. But our deal was I would not have to go to grad school until I knew what I wanted to do. Because undergrad was like grade 13. It was not an option.
Right.
Of course.
It was where.
Yeah.
The question was always, where are you going? Not, are you going?
Right.
And so that was never even an option. And I did tell her, I was like, okay, so grade, what is that, 17, 18? I need some clarity first.
Yes.
So I had a couple of jobs and did a few things and realized that I did want a career, and I wanted a career in which I could be happy. Knew a lot of people around me who were motivated by the paycheck, and that's just never been me.
Really?
And I don't know if that's a good thing or a bad thing, but there's not enough money to buy my happiness.
There you go.
Love it.
So I've always been very purpose-driven and people-centered. And I knew those things had to be at the center of whatever I did in graduate school. So I got some great advice after buying all of these books to explore what you were supposed to do in life. Someone told me, take a pen and a pad, and I'm dating myself because we still did pens and pads back then.
It's all good.
I still
it's all
do.
good.
As do I. And she said, draw a line down the center. Tell me what you're good at and what you like on one side. Tell me what you don't enjoy on the other. And let's then explore where we can eliminate some of those things that you don't enjoy as much and really focus on the things that you do. And public relations was born. I love storytelling, I love writing, and I love being able to serve. So those three things were really things that PR allowed me to do.
Yeah.
So I took the journey to Syracuse, New York. I attended Syracuse University for my master's in public relations. The rest is pretty much nonprofit history.
I love that. Still serving.
Yes.
And still giving, and it was still showing that it wasn't about the money.
Absolutely.
Yeah.
Of course.
And what a wonderful storyteller you are.
She is. She is. She really is.
So, so you were in nonprofit, and you were in corporate spaces, and now you are here doing marketing and communicating for the American Heart Association. What lessons did you learn early on that helps you where you are today?
Be mission driven. That has served me well.
And what does that mean?
It has allowed me to align with organizations that align with my personal mission. So again, paychecks are great. You know, please know, kind of like you said earlier, you're not anti-doctor. I am not anti-paycheck. But what I am is I am also pro-mission.
Yes.
So I believe in purpose. I believe in following purpose.
Yeah.
And I believe in being on purpose.
Yes.
Intentionality is something that I didn't even know was important to me until I hit like my 40s. But that's always been something that's been important to me.
Yeah.
So I have been intentional throughout my career to find spaces that allowed me to be of service, to be happy, and really kind of setting myself up to be successful because of those other two things.
Yeah.
And I will tell you, anytime I have veered away from those three things, it has not worked.
Yeah. You become unaligned because that's, you set the
course.
purpose.
Absolutely.
Yeah. So that really tells a lot.
I like that though, because you know, when you say purpose, there are so many people listening, watching, and purpose. You know, they talk about the purpose-driven life and the, you know, I'm in my purpose, but assignment. Because I also think that divine assignment. Because when we met you, and I wish I had that clip to show it. You know, I played it over and over, and I kept saying, I need her on. We've got to get her on the podcast. I mean, the minute you opened your mouth, I knew there was something about you. Are a purpose-driven person. You are, and you're.
Thank you.
No, thank you. You're about people. Not only does she have this contagious smile, but I see your heart. No pun intended. I saw your heart.
Pun intended.
Pun intended. Pun
Yes,
intended. There you go. Because I
yes.
saw your heart. And when I said to her, we would love to connect, and she was like, absolutely. And you were just so encouraging.
Yeah,
Just from that standpoint, you weren't like, get back to me in about a couple of months or a few
No.
months. You were like
Very gracious.
very gracious. So what was the pivotal moment? Because there are people watching, and like I said, there are young people who are undecided, and they don't have the luxury that you had or still have, having parents, grandparents, to the village,
Yes.
to guide them.
Yes.
They're pretty much out there on their own because they don't have moms or dads or whatever.
Right.
And they just want to be able to be centered and to be on that mission, right? To align with their purpose, their assignment. What would you say to that person? That's your camera right there. Just tell folks how, you know, I mean, I'm undecided. I'm in school because there's so many college students right now. There are high school
Yes.
students who are saying, I'm graduating high school. I'm leaving high school, but I'm going to work at Wendy's. I'm going to work over here. I don't know where I want to go, but I know I love people, or I love this. I love doing that. Speak to that, please.
As a former college professor, as a very unclear undergraduate, I would really offer to listen to your spirit. And again, find your motivation. We're all motivated by different things. Our assignments are different.
Yes.
Our purpose is different. But if you will stay intentional in making choices that serve you and your spirit, you will likely end up in places that allow you to be of service to others and to be on purpose.
That's right.
I like that.
Yeah, to be able to
course.
get direction.
Yes.
You know, it'll guide you and it'll just come. If you are intentional.
If you are intentional.
And purposeful, that, hey, no matter what it is, I know that I can move forward. And oftentimes, if we just look at the things that we've done, it also is a clue.
Absolutely.
And on that list, I often give that list to my clients as well. I just add, what do people tell you that you're good at?
Yes.
Because there are some things that we're good at just comes natural.
Yes.
And we don't recognize it because it comes so natural.
That
And
is
then
true.
once someone says, you should really be doing this,
Yes.
then little light bulbs come up and then you can start to find your path.
Yes.
You know?
And that encouragement, that
Yeah.
encouragement, you know, I mean, there's a thing in Jamaica that's saying, it says encouragement sweetens the labor. So
And that is true.
It is a fact.
That is absolutely true. I've never heard that before, but I absolutely believe that. And find places that feed you.
Ooh, feed your soul.
You know,
feed
the notion of
yes.
encouragement
Yes.
sweetens. You know, that's true. Surround yourself with people and places and missions that actually feed into who you are and who you want to be.
Yes.
Yeah, absolutely.
Wow.
So, Tracy, you started out in public health communication. So tell us a little bit about what that is and what challenges you may have had trying to communicate complex health information to the public.
Well, the beautiful thing in your question is that you answered it and asked it all at the same time. But health communication is really, at its core, the ability to take complex information, science-based information, and put it in terms that people can actually use it. Because that's what it's all for.
Yeah.
Yes.
You know, the numbers, the statistics, all of those things, they're great.
Yeah.
We need them.
Yeah.
They guide us. They guide our next steps. They guide the next set of scientists.
Yeah.
But without being able to process that and use it to better those numbers and those outcomes,
Yeah.
they're pointless.
Yeah.
So my job and my public health career actually started very early, then took a turn, and then I came back. So I credit CDC and my opportunity at CDC for really helping me to land that purposeful place. And I do recognize that all of the steps before that helped me get there, and they prepared me for that.
Yes.
You know, so many times I think without having experiences that are out of alignment, you don't appreciate as much when you get into alignment.
Yeah.
So for me, there were a lot of things, and I won't say a lot. I've been very fortunate to have some really great positions with great supervisors and great organizations. But those few really helped me appreciate when I got where I was supposed to be. So CDC, I was with the Division for Heart Disease and Stroke Prevention. I was there for 6 years. It was absolutely amazing. And that was really where I learned about the American Heart Association and the tremendous work that we do here. Who knew that one of our most tremendous partners would eventually be my professional home? But in that 6 years, I really learned some devastating information. Dr. Sharon, you were talking about this before we went on air, and people just do not understand. And I'm not sure what we're doing wrong in communicating. So I would love to hear what your viewers and listeners say
Yes.
after this episode airs or after you start to get some responses. But heart disease is the number one killer of people in the United States and globally.
It's just mind-blowing.
It's not
Mind-blowing.
just us.
Yes.
It's everywhere.
Yeah.
It is. It is.
You know, and I think both of those things require a moment of thought and pause.
Yeah.
You know, globally, there are so many disenfranchised people and communities that it's not as surprising. But when you start to talk about the most developed, wealthiest, most educated and prosperous countries in the world, and we're still suffering from the same disease and sickness.
And it's getting worse.
And it's not
and
getting
the people are getting
better.
younger and younger.
Absolutely.
Used to affect men, now it's women, now it's children.
Absolutely.
Yeah.
And I don't know which siren we have to sound,
Okay.
but it's time.
Sound the alarm. We do.
You know, we were discussing earlier that cancer organizations and advocates have done an amazing job of positioning and posturing that disease, that you are not only aware, you're fearful, and you do things in a lot of situations to try to avoid being in that situation.
Yes, ma'am.
We don't recognize or lean into the fact that 80%, and I want to sit on that number for a second.
80%. Okay.
80% of cardiovascular events are preventable.
Say that one more time.
80%.
Because people didn't hear you.
80% are preventable. So many people think because I am of a minority ethnicity, because I am overweight, because I've been diagnosed with diabetes, because I have hypertension, this heart disease is inevitable. It is not. For 20% of us, yes. And there's research that's being done to protect those people and to give them alternatives and resources. But 80% of cardiovascular events
Are
are
preventable.
preventable.
Lifestyle changes.
Lifestyle changes,
Asking.
medical interventions,
That's right.
and medical intervention adherence. That is
That's
that
the
is
biggest.
that's another
Yeah.
really, you know, and Sharon, you mentioned earlier the need to lean into opportunities that we have to control
Yes.
our own health outcomes.
Yes.
The preference to feed the farmer versus the pharmacist. I get it. I absolutely get it. But if you are in a place where a pharmaceutical intervention is necessary, adhering to that can be the difference in life and death.
Life and death.
Taking your blood pressure reading and recording it
Yes.
and reporting it back to your doctor or your healthcare professional. Adhering to medication as it's prescribed. Changing minimal changes to your diet, to your exercise routine, to some of the other habits that we've developed. Smoking cessation,
Yeah.
avoidance and cessation.
That's right.
You know, there are so many pieces to a very complex puzzle. And I think a lot of times what you find is people are overwhelmed
Yeah.
Oh, yeah.
between the ask, the demands, the statistics. It can be
Social
very
media.
it can be very daunting.
Yeah.
You know, if all you hear is
Stop.
Stop,
Don't.
stop.
Yeah.
Don't.
Yeah.
You can't.
Right.
You know, there's a psychological barrier there of, well, if I can't,
What can I do?
then
what can I do?
what's the point?
What are my options?
Right.
And so part of what we're doing at the American Heart Association is really being intentional about providing resources that provide autonomy and that provide choices. We are not here to task you with things. We are not here to complicate your already complicated and complex lives.
Yeah.
We are not here to add 10 more things every week that you have to do to a to-do list that is overflowing.
Yeah.
What we are here to do is to provide resources, suggestions, opportunities that enable you as the patient, as the caregiver, as the physician, to continue to empower yourself and others in your life, in your network, in your sphere of care. So, you know, we have things like Life's Essential 8, which is a program that really talks about the 8 things that you can do on a daily basis that allow you to make different choices. It's not about, do you have to exercise 150 minutes a week? Again, that sounds exhausting. Is it true? Sure. It absolutely is true. But is that the only thing you can do? No. So it's not 150 or bust. And so many people, you know, it's like, well, you need to exercise 150 minutes a week. You need to drink 64 ounces of water a day. You need to eat, you know, half of your food and veggies. And you need to stop smoking today.
Yeah. And so, you know what, Tracy, the beauty of that, and which there are some of the centers around Sharon where especially seniors can visit that have health coaches.
Absolutely.
Health coaches it's a shared decision making.
Absolutely.
And it's like, okay, you've named all of those things, but which one do you want to work on first?
Right.
And let's see how, not why you need to do it, but how you can incorporate it into your daily activities.
Absolutely.
Yeah. Tracy, could you list those 8 essentials?
You know what? I do not have them.
I'm so sorry.
That's fine.
And that's my fault.
No,
because I brought them
you
up,
brought it
and
up.
I should have.
No worries.
But what I
fine.
will do is I will get a flyer for you
Awesome.
Okay.
that we
yes.
can post and share with your viewers.
Yes.
And all of this is available at heart.org.
Oh.
So you can go to the American Heart Association's website, which again is heart, HEART.org, O-R-G, and literally type in Essential 8. And all of that will pop up. And the beauty of Life's Essential 8, which is part of the reason that I don't have it with me here tonight, is that we have programs designed for different stages of life. So we have Life's Essential 8 for women.
Yes.
We have Life's Essential 8 for seniors. We have Life's Essential 8 for children.
Wow.
So so there are a myriad of options.
So Sharon, did you see how the marketer and the communicator in her, I thought I set her up, but she set me up so that she can go to heart.org and you can find the
resources. Way to go. Way to go. Way to go. Girlfriend. Way to go. Resources.
I love it.
So we're going to take a commercial break, but when we come back, we're going to continue with the 8. There are other
dialogue.
stuff. Yes, I love it. So here we go. Man, this is great. And we're back. So, coming back, we cheated. We cheated because you shared and we cheated. The 8 heart essentials. So it says life's essential 8. Eat better. That's a healthy diet. Focus on fruits, veggies, whole grains, lean proteins. And you can go research the rest of it. I'm not going to read the whole list. The second one is, like you said, be active. Be more active. And like you really, it's clear. You don't have to do 150 minutes in one day. You really don't.
Yeah.
But you have to move because it says a body in motion stays in motion.
Yeah.
A body resting at rest will stay at rest.
Stuck.
Right.
Yeah.
Just not moving.
Yeah.
You know, so really, WD-40 does not work in that case. I'm just saying.
Hi, Sharon. But
Okay,
you know,
quick.
even for those that are wheelchair bound or are unable to
You can
get
move.
up, you can still
You can move.
move your
You can
hands
move.
up,
And you don't
above
have
your
to do vigorous stuff.
head.
You can move.
Increases heart flow.
Yes.
And so there are just some range of motions, even just doing this.
Of course,
Yes.
of course. People think
and
they
neck
have to be pushed.
exercises.
Yeah.
That's
yeah.
it. Legs.
That we can do, yeah.
You can try whatever it is. So third, it says quit smoking. That's it. No vaping, no smoking, nothing.
No.
Say that again. No what?
No vaping,
Vaping.
no smoking. I
And,
said
let-
it.
and just a PSA. Vaping is actually worse than
Worse.
smoke.
There you go. Toxins.
So
Okay.
more.
just be clear. You know, we need to avoid all tobacco products, but please do not think you are doing yourself a favor by putting down a cigarette and picking up a vape. That is not the right direction. That is not a move you want to make, and that is not improving your health.
Health.
I love that because, you know, thanks a lot. Because if you notice, and it's business, but you know what? Those vaping places, they're popping up at every
Everywhere.
corner. You
The
cannot
gas
drive
stations,
everywhere.
everywhere.
It's available everywhere. And now I notice people who never smoked cigarettes are vaping.
Right.
That's what's scary. Oh yeah,
And
because the
it's-
flavors and the different smell
And the
I'm like,
flavors
are
and the,
they're very
the flavors,
attractive. They
the
said
smells,
Yes.
are all
Addictive.
chemically induced.
To make you
And
want to
so-
increase that dopamine.
Absolutely,
it is.
And so you are getting more of the chemicals. You're getting more.
Than just plain nicotine.
Exactly. So
Yeah.
this is definitely not an improvement.
Yeah.
So yes, we
yeah.
need to avoid all tobacco products. We need to avoid vaping at all costs.
At all cost.
And
Yes.
young kids,
I read something- yeah, I read
get
something
away with
recent-
it because you don't have that lingering smell like cigarettes. So they
Well, it
can
has all
smoke
the
and
cute
don't.
smells. It has the cherry and the pineapple, the
Strawberry,
flavor,
yeah.
the strawberries,
Yep.
whatever. So it's it's cute. They think,
Yeah.
but it's really not,
It's
and
not
that's why they're
cute.
dying earlier.
Yeah.
they're getting sick. They're having heart attacks. They're having
Yeah.
all that.
definitely-
I mean, really.
Definitely not a better choice.
It's
There's
not.
not a good choice in those categories. But please be clear that is not a better choice.
Thank you.
Wow. So the essential 8, it's eat better, be more active, quit tobacco and vaping, get healthy sleep. Critical sleep.
Yes, we are guilty
Because-
off of that.
Of course, people say, "Oh, I function on 4 hours."
Yeah.
Not true.
And think that's
it's cute.
Well, and again, that's not a brag point.
Yes.
You know, just because you can doesn't mean you should.
Right. And it's
So
healthy for
it's
you.
not healthy. It does not help your body. You know, it might help you get through the day in the short term.
That's
But
right.
that is not the long
Yeah,
play.
you're just putting
So,
more stress, more
really-
cortisol
course.
into your body.
Absolutely.
And you know, our elders who used to maybe go on 4 hours, but they were able to nap.
Yes.
We can't nap.
Oh my
No.
gosh, we know we don't.
They were able to nap in the day, and they still went to bed early.
Our
Yeah.
generation, especially,
Yeah.
we don't know about napping.
No.
Yeah.
I mean, we may snooze off if
I
we
was
sit
about to
too
say, you
long.
may fall-
we may
you may
fall,
not fall
fall asleep.
but
yeah.
not intentionally
Not
taking a
intentionally
nap.
at all.
Correct.
And napping is a good thing.
It is. Sleep is a good thing.
Sleep is a good thing.
Healing, right?
This
That's where
whole
healing
notion
happens.
of you can sleep when you die, Bad advice. I've heard that a lot.
Wow.
I hear a lot of people say, living is for grinding, and no. You have to make time
To sleep.
to sleep.
Isn't that so
Because
funny?
To your point, Dr. Sharon,
Yeah.
there is a healing process that takes place when you're sleeping.
That's right.
That cannot take place any other time.
Yes.
So allowing your body to heal and reset and regenerate is essential,
Exactly.
pun intended,
Yes.
to good health, and
Yes.
particularly good heart health.
Of course. And with your essential 8, it does state right here, it says poor sleep is linked to heart disease, obesity, and high blood pressure.
Absolutely.
So why would you do that to yourself? Why would you want to invite diseases onto yourself?
And then celebrate it.
Yeah, I've heard people say that so many times, and it really bugs me out.
Yeah.
Oh, I don't need more than 3 to 4 hours. I'm good on that. And I'm thinking, if you think that's a
Your mind may
rite
be,
of
but
passage,
your body
it's
isn't.
your body,
Right.
yeah,
And your
yeah.
mind isn't.
And you really,
Like
because
you have no
sleep
idea
deprivation
what your
is a real
optimal-
thing. Yeah.
And you have no idea what your optimal performance really is. If that's what you think is good, imagine how great you could be with 6 to 8.
yes,
If 3 to 4 keeps you going, imagine how productive you would be
Yeah.
with the appropriate and proper amounts of sleep.
Sleep. For your body. I mean,
For your body,
Of
for
course.
your mind.
because there is a range, 6 to 8, but
Yeah.
yeah. Yeah, Sharon, was
Man.
that 8? Was that all 8 that you? Oh.
no, that's only up to number. What?
Well, let's
number,
make sure they go to heart.org. So let's
Yes, we're not going to give them any more. You've got work to do.
So 5 through
That's
8.
homework.
Work to do, yes.
That's homework.
Yes.
There we go.
Hell,
All
I like
right.
that.
I'm telling you, the market in her.
Oh, it is.
It's
It
just
is.
a natural thing
It
for her.
is. So you tell me some of the common challenges when you're trying to communicate complex and health issues to the public. What are some of the challenges that you find?
Oh, the misconceptions.
Right. So in layman's term, because we don't speak medical needs. I mean, there are people who just
Correct.
don't even know, and we need advocates because there are times, and you said something earlier, Trayce, that people are given prescription and they should adhere to them. But truth be told, medications have side effects. And if you're not able to navigate through that kind of stuff, I'm blessed enough to have family members who are doctors or medical professionals that I can call and say, hey, Donna, hey, so-and-so, can you tell me what this is all about? I read it, but I don't even understand this kind of lingo.
Right.
I don't. But I mean, for folks who are, the doctors do it. And I'm not knocking them. I'm just saying the doctors may prescribe something. And so many times people go misdiagnosed because I've known of cases where people are getting treated. I'm just giving an example for arthritis when they have a blockage. And the medications are different. Now, how do you really know? Because you may be taking what they're prescribing because over here they said arthritis. But over here, it's a blockage. But you don't know. So you're taking something for arthritis. You don't have it. You don't have anyone to tell you, what you're about to take. So talk to me about that. How do you communicate that? And
So what you just said, there's a lot of unpacking to do there. Let me start with the advocate. You have to be your primary advocate. You have to advocate for yourself, and when you can. Let's be clear. Some people cannot.
that's right.
And when you can't, you need to appoint
That's
a
right.
medical advocate,
That's right.
a child, a friend, a medical professional. There are some insurance companies that will actually allow you to have, there are practices that will ask you if you need an advocate in the room with you, which is, a sign of a great practice.
It is.
But asking questions. I don't think you should blindly follow anyone,
Thank you for
even
that.
a physician.
Absolutely.
That's right.
So if they're asking, if you have questions, and do your research. I love the fact that you go and look up things and figure out what the side effects are, and you call Donna and ask, what is this? Everybody doesn't have a Donna.
That's true.
Everybody doesn't have access to the internet. But there's internet at your local library.
Yeah.
You know, you can go to the fire station to have your blood pressure checked. There are resources within the community that actually allow you to explore these numbers and these questions. So, but put your physicians and your pharmacists to work.
That's
That's
right.
right.
Ask the questions.
They are medical servants. They are not just providers.
Yeah. Or the
So-
experts.
Yes. So ask
Yeah.
those questions. You know, what are the side effects to this medication? And is there something that I can do to offset
Yes.
those side effects? If your physician is not willing to provide that, then find a physician who will.
Who will. Don't be stuck
Yes.
and loyal to someone that is not
No.
breaking down what you need.
No.
Yeah.
Questions, you have the right to ask questions. Pharmacists, on a very basic level, do look for medical interactions. So there is a safeguard there that doesn't offset the situation that you explained. But again, if for some reason you get to the pharmacy and you don't remember what the doctor said or it didn't quite make sense, you know, reach out to your pharmacist and your pharmaceutical techs and ask them, what are the side effects? Is there a way to offset them? Is there a medication that better works with my other medications? You know, these people are here again to serve and to be resources.
Yes.
So let's give them the opportunity to do that.
Yeah. I love that perspective.
But being your own advocate is the
Yeah.
first place to start.
Yeah.
And that is part of advocacy, is asking
Thanks.
questions and seeking information.
Yeah.
But,
I
you know,
love
she also
that
said it, I like that.
perspective, Sharon, where she
Yes.
says that they are your servants.
They are.
in service.
They are.
That's a mindset shift because
Yes.
we are taught that they're the ones who can tell you, they're the ones who know best.
Absolutely.
But I definitely teach the power of the question. And oftentimes, if you don't have an advocate that's able to come with you, I always tell my patients/clients, you need to have a
Notepad and a pen.
Yes.
Of
and
course.
then don't be afraid to ask, could you spell that for me? What are you
Yes.
ashamed
Yes.
about?
Yes.
What did you just write down was my diagnosis?
Absolutely.
Write it down. Oh, these are my lab results. Well, what does that mean?
Yes.
What is the range? And so when you start asking questions, guess what? The next time you come, the providers start to give you explanation.
Absolutely.
And they like when you ask about your health. If you
Yes.
don't be, my thing is that message
Don't be
from what you-
intimidated.
Don't be intimidated.
But you know what?
Thank you, Sharon.
I'm going to play devil's advocate, though, Sister Sharon, because guess what? I don't know how to write. I can't write.
Then
I don't know how to do it.
Do you have
but
a
we
cell
all
phone?
have this
That's what I was
device.
gonna say.
Use your cell phone.
We all have this. We all have this device.
That's
Use
right.
it.
Use it.
What
There
was
you
that
go.
you
There
said?
are-
Give me a second.
There are dictation
That or
options.
record
And
it.
seek
Yes.
that information.
And
That's it.
also for the advocate, just because they can't be in the room doesn't mean they can't be on the
That's
phone.
it. That's right.
I know
So-
I've
That's
been on the
right.
phone many
Of
times.
course.
Yep.
Absolutely.
Of course.
You know, from anything from FaceTime to a
Yep. Yes,
traditional
ma'am.
call.
Yep.
If the doctor is
And
explaining
if they're
something and you
refusing,
don't-
that's a problem.
that's a problem.
Absolutely.
If they refuse, that's a red
Absolutely.
flag.
When they give you your diagnosis, if you don't have anyone with you and you can't write it down, record what
That's
they
right.
say and
That's
play
it.
it back to your advocate.
That's all.
You know,
That's all.
use the resources we have
Yes, ma'am.
at hand and make sure you are advocating for yourself, for your clarity, and for your health.
Yes,
You know, all of those things you have a right to understand.
of course. because it's prescribed doesn't mean you have to take it, because, there's side effects. Things happen.
Absolutely.
And so you want to be clear
you do.
before you, you proceed.
And also, I think that leads to a really great question. Having the conversation with your physician about, is this required or recommended? Because those are not always the same thing.
Speak
I'm going to ask you to stop right there and repeat, because that's powerful.
Required versus recommended. Those are not the same thing.
Absolutely.
They are different to your diagnoses, and the adherence is different.
Yeah.
There are things that they might recommend that may make you more comfortable. There are things that are required that keep you alive.
Of course.
So asking that question alone gives you power and options.
That's right.
And we live in a world
That's
quick
right.
fixes.
Yeah.
We
Yes.
want quick fixes. And
Yeah.
so when a doctor says to you, Sharon, look, I'm going to write you a prescription for that. I'll be honest, I'm not embarrassed to say it. And yes, I'm saying that on online and making sure you hear. I'm one of those, I am deathly afraid of medication. So if you tell me go home and eat 1 banana, 2 oranges every day, eat a pear, sign me up. Sign me up. But if you tell me pop some pills, drink this medicine, we're going to have issues. Because I'm just one of those girls. I'm just wired that way. So speak to your doctors. I don't think the average medical professional, this is just my opinion, and you can correct me if I'm wrong. If you engage them and you're not combative, of course you're going to find the, 1 or 2
I don't
that are
have
just
time.
yes,
Next.
yes.
There are outliers.
Exactly. But I'm sure if I say it to you, Doc, I'm not good with medication. I hate medication, to be honest with you. I'm one of those that cringe. Is there a natural way? Can you give me a list of stuff to do, a list of to-dos?
Yeah.
Go home and don't do this or do this. Yeah. Can you do that? I know it's probably, you're not going to see me, maybe not for another year or 2 or 10 years from now, but I'm sure they would be willing to say, you know what?
Absolutely.
Yes, you can do this.
Yeah. And if they
And
can,
they have a heart.
refer you.
Of
I was
course.
about to say,
yes,
if
you get a
they can't,
referral.
You can get a referral to
Yes.
a dietitian.
Yes.
You can get a referral to a doctor who specializes in holistic medication.
Yes.
So there are options.
There are options.
And when
Yes.
you have that resource of access, please use those options.
Yeah.
Yes, ma'am.
Because to your point that you made earlier, Sharon, everybody doesn't have access. But when you have access, you have to
it.
be
Use it.
an advocate and you have to use it.
Yes, ma'am.
Yeah.
That is something that so many of us take for granted.
Yeah.
And you really can't.
Yeah. And I'd love to tell a quick, short storyteller. When I was health coaching, I was in the room with the provider, and the patient was supposed to now start insulin injections. And so the doctor said, okay, Sharon, go ahead and explain to her what is expected. And she started to cry. And I asked her, I said, well, you're taking your blood pressure medications, right? She says, yes. I said, but you're not taking your insulin medication, which was prescribed for 3 times a day. I said, can you tell me why? And she says, well, I just don't have the time to take it 3 times a day. And I says, what do you mean? I can take it 1 time, but I now forget, and then I change my purse, and the medication is not in there, and I just haven't been taking it. And so she was like, please, I don't want to take injections. I'm so scared of and started crying. I said, I'll be right back. So I went to the provider and I said, can we give her a long extended, a different type of medication that she can possibly take once a day? And she looked at me. I said, can we just try? And the doctor said yes. And so we gave her the prescription. I said, now you're going to take it once a day, right next to your blood pressure medication, and in 3 months we're going to check your levels. Came back. it dropped over 4 points. She was so elated.
Wow.
Hugged and kissed. And so I say that just to talk about the power of also health coaching and having the advocacy and knowing how to ask the right questions. And so sometimes the doctors, I'm definitely going to use it, required or recommended, because some things are required. Okay? And the doctors oftentimes just do what they know, that this is the protocol, following the protocol instead of following the patient and having shared decision making. And I think that that's the power in what you do as someone who communicates public health and someone who also markets for American Heart Association. We gotta give the AHA a
big. And we got 4 minutes left. I mean, we're literally just about winding down. I can't stand this part of the show. I really don't. I don't like this part at all. I must confess. And so, if there's anything that you could leave with the public that because you're with the American Heart Association. What are some of the initiatives would you say that you're most excited about right now?
Right now, the Go Red for Women campaign is absolutely phenomenal. We are really leaning into the notion that red means go.
Go. I like that.
I like that a lot.
Not stop,
Yes.
but go. I love it.
Yes.
And so we have National Wear Red Day during Heart Month. Locations across the country do our Heart Ball where most people wear red.
Yes.
We have our Go Red for Women luncheon. We have different campaigns that engage women across the country to fundraise and advocate on behalf of the American Heart Association. We do advocacy again. I met you ladies at the Capitol.
Absolutely.
During Advocacy Day for us here in Georgia. And I think what I would like people to walk away with is understanding that, again, heart disease kills more people in this country than all cancers combined. So there is a need, an urgency to act, to move, to eat differently, to just attempt every day to be a little better.
Yeah.
Take care of your heart, and it'll take care of you.
Yes,
Hey,
and
that's my
there's something
saying.
we shouldn't wait until we're all grown adults. We're all adults. We
No.
should start. I honestly
Sharon, that's
think
a
that would be
big, big
something
point.
children really need to know how.
Yeah.
I mean, little kids. I mean, from
Absolutely.
daycare.
Yeah.
They should be taught right there what to eat, what's good for you, what's not good for you. And I'm not knocking your Halloween. I'm not raining on your parade. But I'm not an advocate for Halloween because of that. Or the Easter egg hunt with all this chocolate and all these candy and all this stuff that we're loading up our children with and making them sick.
Yeah.
Okay, we can find healthier options. In those Easter baskets, why don't we try some healthier options this Easter if we have to do that? Just a plug, a shameless plug, and I'm not embarrassed to say
And you
that.
should not be at all. Apples look really nice in Easter baskets.
Yes, right.
Yes.
And there's so many different types
Yeah.
that you really could have a great time just going and figuring out
Decorating
your
those.
Yes,
Yeah,
yes.
absolutely.
Like, I'm a Honeycrisp girl. What
There you
about
go.
you?
You know what? I like Golden Delicious.
Okay.
And Fiji.
Okay.
Okay, yes.
So
variety.
There's
It's
a
whole
challenge to
variety.
the audience to go
What's your
try
favorite
all
type?
three of those and
Yes.
figure out which one is your favorite.
Yeah.
And not to rob the candy, but do less.
Right?
Do less
Forgot about
candies.
that.
And I mean,
Rob the
Halloween, when you
yeah.
go out trick or treating,
Yeah.
healthier choices. And there are quite a few people who have adapted, but let's start there.
Absolutely.
And start training our youth, because I think what's that saying that you could train broken children. You could train children while they're young, but you can't. Something about broken men, whatever that saying is. So you train the children up while they're young. You start with them.
Absolutely.
And when they get to our age, they'll already be experts.
And obesity
So we
will
won't
be
have
thing
that
of the
problem.
past.
Of course.
Smoking will be thing of the past.
Totally, because everybody's
Yeah.
health conscious.
And one of the things that folks can find at heart.org is we actually have heart clubs for children.
Oh, really? I didn't know
Girlfriend.
that.
Absolutely.
I did not know
Wow.
We
Are you
have heart
joking?
clubs that
For
are
children.
set up at elementary schools, middle schools, high schools, and college
that. Oh, that's
campuses.
wonderful.
I
did not
love
know
that. Wow.
That's great. That's
Well,
really
thank
great.
you so much. We appreciate you coming out. We're going to have you back here because
For Heart
we've
Month,
got
for
Heart Month,
sure.
of course.
I would love to come back.
So
And
you
you
have-
know, May is actually American Stroke Month.
Oh, wow, yes.
We can come back and have another
talk about
conversation.
So we're putting her on the calendar.
That's
Because
right.
Stroke is the number 4 killer
That's right.
of Americans.
Yeah, and you
Really?
know, many people mix up the symptoms for a heart attack versus the symptoms for a stroke.
Absolutely.
So when I'm teaching CPR, I ask, and many times it's stroke.
Yep.
So you have to make sure you recognize the differences between the two, which goes into what you're saying, be educated and ask the questions. We definitely want you back.
And then we have CPR week as well. So
Oh.
you can do a demo. Like,
Yeah.
we have all kinds of
Oh, I
things.
love it.
I've got all kinds of stuff to talk
Girlfriend. Okay, so
All right, then.
We gotta-
So,
we
you know,
we
we
thank you
appreciate
again.
you for coming. Thank you so much,
for
Ms.
having
Tracy.
me.
Absolutely,
Is
thank
there any
you.
way that we can people can contact you, or do you want them to go to straight to heart.org?
Heart.org is going to be where you can get in touch with all of the resources that the American Heart Association has available. But I am absolutely open to direct communication. My email address is trace.leak@heart.org.
Easy enough. We will
Easy
make
enough.
sure that we
Thank
will
you.
link that. And so again, we thank you. We thank American Heart Association. We thank you for the work that you've done. We appreciate also APAP Media Group, which is a full-service media company, for sponsoring this show. We want you, SpeakHarmony family, to give us comments, talk about what you've learned, tell us what you want to learn. Join us next Tuesday right here, live on YouTube, 7 to 8 p.m. as we continue learning from those who inspire us through action and what? Purpose.
Yes.
So until then, family, speak harmony.
we would love for you to like, always, subscribe, and share. And set your alarm, set your links to SpeakHarmony so you never miss an episode. We shout out again to APAP Media. See you next week. Same time, same place. Until then.
They talk about health, they talk about care, sharing tips, they got us without a care. Thank you for listening, you're the best. See you next week to keep the best. Together we learn, together we grow. There'll be lesson every hour, we know. See you next week with new stories to tell. More wisdom